So, welcome to our sixth revision guide. We're going to keep going with medicine today, and we're going to be looking at the 18th and 19th century. So, there's two questions this week we're going to focus on: is the explain why question and another statement question. The explain why question is going to be, why was there a rapid change in the understanding of disease? So, we're looking at germ theory, Pasteur, and the work of Koch. And also, the statement question is going to be about Jon Snow and cholera. So I know we've got mocks this week, but if you have a chance to do any of these questions, that'd be really, really good. Okay, so 18th, 19th century. So we're going to stick to the same format. Basically, what do they think caused disease? How did that improve? How did they improve treatments? And our case study is going to be Jon Snow and cholera. So let's just remind ourselves of some of the key things with germ theory and microbes. So the old ideas of miasma were still quite prevalent during this time. Also, they began to theorize something called spontaneous generation. So this was an idea of, rotting things that were rotting, smelling things, were somehow spontaneously generating things that were causing disease. Now, also during this time, there was new technology developed in glass, and microscopes were produced, better and better microscopes, which enabled scientists to clearly see small objects. We would know them today as bacteria. So microscopes was just another example of more rational thinking in terms of technology and how things worked. Now, Louis Pasteur famously was employed by a wine company because they were trying to understand why their wine was going bad. He did a series of experiments where he took his flask up the mountain, in the field, in the city, and basically through those series of experiments he proved microbes in the air were causing decay and the wine to go bad. So he began to theorize that maybe possibly these microbes are also causing disease. Now, this was taken a step further by the German scientist Robert Koch, I should say, and he actually proved that it was microbes that caused disease, and actually took that a little bit further and identified specific microbes, so tuberculosis in 1882 and cholera in 1883. So as that picture shows on the top right, obviously different shaped microbes, different shaped bacteria were causing specific diseases. He also did something else that was quite important on his second stage. He developed an agar jelly, which enabled him to grow bacteria and observe its growth. And also he developed dyes so that he could observe, or other scientists could observe, how bacteria was behaving under the microscope. Okay, the next section is about hospital care. Now, Florence Nightingale, we all know, led a team of nurses during the Crimean War. Her understanding of germ theory was non-existent. She believed that miasma was causing disease. So logically, therefore, if it was bad smells, bad air, keep things fresh air, hygiene, and she trained all her nurses under her wing. That was the way to do it, and she was incredibly successful. The death rates plummeted to 2%. Because she was the daughter of a wealthy man and lots of connections, her success was widely published. When she returned back to the UK, she set up a training school for nurses, and lots of her books were published. So generally, the improvement on hospitals was general hygiene improvements. Nurses were trained to work alongside doctors, where previously they'd been really seen as helpers, or so they had much more input than they had before. The government or charities began to set up more infirmaries for poor people, and this was the first time really when we began to have specialist hospitals like Great Ormond Street for children, or asylums for people with mental health. Okay, also during this time, a big improvement was to do with surgery. Anesthetics. Traditionally, people, if they're having surgery, would drink lots of alcohol, try and pass out. That wasn't very successful, because if somebody sticks a scalpel in you or a knife, you are still going to move. Okay, so this was developed further by American dentists who developed NOS, laughing gas, which was quite effective pain relief. But again, the patient was still thrashing about and moving about. Ether, very good anaesthetic, but unfortunately incredibly flammable, and also irritated the throat of the patient, causing them to cough. So James Simpson came up with chloroform, and after that was cocaine, which is obviously very addictive. Both of these were good anaesthetics, but also had their own problems. So James Simpson discovered and promoted chloroform. He was just mixing whiskey and all kinds of weird and wonderful drinks at parties, and realised it was knocking him and his friends out. So it was an incredibly effective anaesthetic. The problem with chloroform, like probably any anaesthetic, is really the correct dosage. You could give, if you gave too much, it would stop the heart, because what chloroform does is it kills cells in the brain, and it was basically killing heart cells as well. So really, if you're, a 6'6" man, you're going to need a bit more chloroform than a 5-foot woman. So it's about getting that correct dosage. Antiseptics. So remember, antiseptics is really a chemical substance to kill bacteria. So before antiseptics, half of patients who went in for operation died from infection. Half. Joseph Lister, again, was a British doctor. He discovered, purely by chance, that carbolic acid that they were using in the sewerage that was killing bacteria was also going to be very effective in terms of an antiseptic. So he used this acid to clean his equipment, and he also developed a spray that they would spray during operations, which tried to sanitize the area. The impact of this was, first of all, with anaesthetics, there was actually at first a lot of resistance to this. Some Christians believe, for example, women, childbirth was supposed to be painful, etc., etc. So God had a plan, and therefore people, pain. I can understand this. If you've got toothache, you go and see the dentist. So in some ways, they said if you can't feel the pain, then obviously you're moving away from God's plan. And also people, I also think, quite understandably, were worried about being unconscious and dying from being unconscious. Antiseptics, really successful. The idea spread very, very quickly, and eventually it led to aseptic wards in hospitals and theatres. So overall, this was a massive improvement. Surgery became pain-free and much more successful, i.e. patients survived, and surgeons could try and do more complicated and deeper operations. Okay, another big development at this time was vaccinations. So when Pasteur published his germ theory in 1861, his team of scientists continued to work, and they realised, again purely by accident, when they were helping out with some chicken cholera issues, that a weakened version of the disease would give the animal, in this case the chicken, relative immunity. So they did various experiments and proved that this happened, and Pasteur decided to name this discovery as vaccination in honour of Edward Jenner, who he admired. So this led to a development of all kinds of animal vaccines, rabies, chicken cholera, and eventually other scientists began to develop vaccinations for other human diseases. Okay, also, the government was beginning to play a much more important role. So this is really down to changing attitudes. So remember, the traditional attitude of the government was laissez-faire, this kind of hands-off approach. People do what they want. It's not for the government to tell them. However, there were some fairly serious cholera epidemics in major cities in the UK, and people felt the government was the only person who could help. And people began to realise that really a lot of this was down to the poor living conditions. And in 1867, many poorer people, many working class people, particularly in the major industrial cities, were given the vote. So obviously lots of working class MPs went to Parliament for the first time and began to say to the government, you need to make changes. The impact of that was a new law called the 1875 Public Health Act, which was one of the most important laws to do with medicine. So this ensured that councils had to provide clean water, sewers, toilets, parks, all these kind of things that we take for granted, but also importantly, they established a system of inspectors, whether that was housing, restaurants, shops, all that kind of thing. So basically, they had to provide the basics, amenities, but also inspecting what was available and have the power to close things down. Okay, our key individual from this point is obviously going to be Pasteur and Koch, but Jenner is somebody the exam board is really highlighting as well. So remember, what Jenner was about is about smallpox. So smallpox was a horrible disease. Millions and millions of people were getting killed. And the treatment for this traditionally was inoculation. So they would take a milder version of smallpox, inject a patient, but it was incredibly dangerous. I think it was like 1 in 20 people who inoculated actually contracted the disease and died. Would you want to take that chance? No. So Jenner was living in the middle of Gloucestershire, a really rural place, and he noticed that milkmaids who'd contracted cowpox never ever caught smallpox. So he began a series of experiments, actually with his neighbour's boy, you can see in the picture there, where he injected him with cowpox, and he survived and didn't get smallpox. He began to publish his findings, and eventually, by 1852, the government was paying for compulsory smallpox vaccinations. So why is he important? Well, he's important because he used scientific methods, and eventually the disease of smallpox was wiped out and eradicated in 1979 after a worldwide vaccination campaign. However, it's important to understand that Jenner was before Pasteur. He didn't really understand, he didn't know about bacteria. He didn't really understand how it worked. And it's just purely by chance he'd made the connection between cowpox and smallpox. And in fact, again, as like a lot of these medical things, there was a huge amount of opposition. People didn't like the idea of being given a disease by an animal. And again, I can understand that to a degree. There's nothing to do with Drake. People thought this was God's plan. If you're going to die, that's God's willing. That's what should happen. You shouldn't be able to stop that. And the biggest opposition was actually doctors, because they were getting paid quite a lot to inoculate patients, and they were losing that because the government was now paying for free vaccinations. Okay, last but not least, our case study on this is cholera in London in 1854. Now, the causes, again, pre-Pasteur, they believed it was miasma, spontaneous generation, and they kind of made a link that this was particularly affecting poor areas, but that was about it. So what did they do to avoid catching it? They cleaned the streets, they cleaned up rubbish, but obviously it didn't help because they didn't know that it was a waterborne disease. Now, who really helped out here was John Snow, and he really, what he began to do, he kind of made the connection between this water pump in Broad Street in Soho, and he began to map out the people that were dying around, and obviously realised that the majority of people dying were taking their water from this pump. And he actually persuaded the council through using this statistic. So really, we are so used to seeing pie charts, bar graphs, blah blah blah, all stats presentations. We're so used to seeing them, but really he was the first person to use it, presented to the government, and they removed the handle from the water pump. So why is he significant? Well, he drastically reduced the deaths of cholera during this outbreak. Eventually, it led to the building of a new sewer system with Bazalgette in London. The problem was, again, he was pre-Pasteur. Okay, I think he knew deep down what was doing it, but he couldn't prove it. Okay, can't prove it, so people kept saying, well, we don't need to do anything about it then. So there's no actual proof. So obviously this is why Pasteur is so important.